Good morning, everybody, and thanks so much for joining us. I'm Will DuPree.
And I'm Erin Cargile, coming to you from our next star station in Austin, Texas. A very good Tuesday morning to you, Tokyo Tuesday. We usually come to you at the beginning of the month, but of course last week it was a busy one with the election happening on Tuesday, so here we are 1 week later.
Yeah, that would have been a lot to handle for one day.
For you especially, as you were basically on air, online the entire time. So we were just saying feel like we're still recovering, as you probably are too.
Yeah, the coffee is very flowing this morning, and for sure I need that. So again, we are coming to you for our Japan 2020 stream. We're trying to share our team's latest reporting about the preparations for the upcoming Summer Olympic Games. But first we want to start today talking again about the COVID-19 pandemic and where it stands at this point, not just in the U.S., but across the world.
Yeah, we want to look at the latest numbers right now. The Centers for Disease Control and Prevention report the U.S. is close to logging 10 million coronavirus cases since the pandemic began, and the number of lives lost in our country, just our country alone, is almost 237,000.
Yeah, because of those rising numbers, the governor of Utah actually issued a statewide mask mandate this week to try to curb the spread of the virus. And right here in Texas, the county judge in El Paso says he plans to extend a shutdown order for non-essential services after a spike in cases and hospitalizations. And
here's some more numbers for you to absorb this morning. The World Health Organization is now reporting more than 50 million cases worldwide, as well as almost 1.3 million deaths from the coronavirus.
In Tokyo, Olympics organizers recently held a demonstration on possible measures they might take next year to combat the pandemic. Last month, they displayed several screening protocols at the convention complex that will serve as the media center for the Olympics, Erin.
Yeah, a lot of them look familiar, but what you're seeing right there, we're going to explain what was on that person's wrist here in a second. But, you know, we've got hand sanitizer, guards wearing face shields. Those are things we've all seen. That innovation, though, on that person's wrist is a sticker that can actually measure body temperature in just a few seconds.
Tokyo organizers and the International Olympic Committee have said they are testing many scenarios and are unlikely to explain until early next year exactly how the Olympics can be held safely. So, of course, we will continue to wait to see what exactly they nail down and specify about those protocols.
Yeah, and I mean, we're learning a lot about what's happening right now with various events here in the U.S., in other countries as well. And so at least it's good to hear them talking about it, because as we've been talking the last few months, and a doctor that we're going to hear from, and that we always hear from here in just a few minutes, talking about we need to see them starting to plan out some of the prep and what they're going to do to keep athletes, fans, you name it, safe in Tokyo if and when this thing moves forward.
Very important. Also, there are new developments to share in the search for a COVID-19 vaccine.
Yeah, Pfizer says early data shows its vaccine may be 90% effective at preventing the disease caused by the novel coronavirus, and the company stresses this does not mean the vaccine is ready, but Pfizer is on track to file an emergency use application with U.S. regulators later this month. Certainly good news there.
Well, with that news, let's bring in a doctor we have checked in with regularly during this pandemic and for the past few months. Joining us this morning is Dr. Stephen Thomas, who is the chief of the Infectious Disease Division at the Upstate University Hospital in Syracuse, New York. Dr. Thomas, thank you again for joining us live this morning via Skype.
Oh, it's my pleasure. Thanks for having me.
First up, Governor Andrew Cuomo announced just this week that you have been appointed the lead principal investigator for the worldwide Pfizer BioNTech vaccine trial. I guess we should say congratulations for that responsibility, but what exactly will that entail for you?
So thank you for that. So what it means is that this is a phase 3 trial, 44,000 people, around 140, almost 150 sites around the globe. Each of those sites have a principal investigator, so a leader of a team that is working at that site to enroll volunteers and to administer the injections and then to collect information. And then what the company typically does is they'll select one of those investigators from one of those sites to serve in an additional role, and that additional role is to help review information and to help support the company as they compile information and submit that to the FDA.
Well, it's a big job, certainly, and congratulations again. We're just lucky to have you here with us every month, and you taking the time to talk to us and everyone out there on top of all your other duties that you've got going on now. Excuse me. What's the most notable thing that we should take from this development about a potential vaccine from Pfizer? 90% effective. I mean, that sounds pretty good.
Oh, it's great, and I think it probably exceeded many people's expectations for what that number was going to be. So, I would echo what the CEO of Pfizer has said, in that this is an incredible first step, but it is the first step in multiple steps that need to be taken to ultimately have a safe and effective vaccine that's deployed in large numbers around the country and around the world. So yes, it is a bright spot. It is a good piece of news, and otherwise somewhat of a bleak landscape based on a lot of the numbers that you were talking about earlier.
Well, exactly how much hope should we glean from this development? It was met by a lot of relief from people yesterday when it came out there. So in your opinion, how much hope should we take from this?
Well, just in general, and this is, this is just me, I guess, personally. I think the emotion of hope and the feeling of hope and the feeling of optimism, you must have that for us to remain resilient and to be able to make it through this pandemic. So, vaccine or no vaccine, I think people need to maintain their hope and their optimism, because it's going to give them the drive that they need to continue to do things, do the things that we need to do to try and flatten the curve in the country and globally. Speaking specifically about the vaccine, though, this is really important information. And again, it exceeded people's expectations. I mean, just for context, the 2019-2020 influenza vaccine, the efficacy was around 45%. So coming in at something over 90%, that's you can do the math very quickly. That's almost twice of what we get from annual flu. And the annual flu vaccine prevents a lot of people from getting sick. It prevents a lot of death, and so the implication here is huge. It's big.
And what doesn't get us excited is the fact that we are the U.S. is continuing to set daily records, the wrong kind of records for new COVID cases. Do you agree with other health experts that we're headed into a really dark period? Plus, we're heading toward Thanksgiving, Christmas. What are your takeaways?
Yeah, the takeaway is that we're not heading towards a dark period. We actually are in a dark period. I was looking at some information from the 1918 influenza pandemic, and just looking at different, curves for different states within the United States, and the big concern back then was these rebound curves, right? So you had your initial outbreak, and then places that stopped public health interventions or opened up the economy too soon, they had these rebounds, and the rebounds were worse than the initial wave. What we're seeing now in the United States is a third peak. So we've already been through the first peak. We had a decrement, then we had a second peak bigger than the first, another decrement, and now we're seeing a third peak, probably all the same wave, but at least a third peak. So it's very, very concerning, and so I think we're already in that dark day. I don't want to talk about dark future days, because I still feel this is very much within our control. I mean, we know that if there is broad application and consistent application of public health interventions and the diligence on the part of our communities, we can bend this curve. We can flatten this curve. So everyone getting a flu vaccine, if they can get one, wearing masks, really reducing that social circle that they're involved in. So that what that means, practically speaking, to me, is the immediate household that you live with and a very small inner circle of friends or other family that you may not live with, but that you know how they've been spending the pandemic. You know if they're traveling. You know if they're mask wearers or not. You know if they partake in risky behaviors or not. You should really keep that social circle small. And then the hand washing, and this is also really important. People, let's say every fall/winter, you get a runny nose. In 2019 and 2018, that might be your allergies. In 2020, it might be COVID. So people have to stop self-assessing and stop self-diagnosing. If you have a sore throat or a headache or a runny nose, you need to not go to work or not go to school. You need to talk to your medical provider, and you need to get a test, because COVID can present in so many different ways. We can't have people self-diagnosing. So if we do all those things and we do it consistently and we do it broadly across the country, we can change what could be a dark future into something different.
Yeah, I like that you said that. I mean, I think Will and I both, I mean, we've had different sicknesses over the last couple of months and immediately went and got a test because I'm no doctor. I don't know what this sore throat means. I don't know what this stuffy nose means. Even our 7-year-old at home, let's just go and be safe, because thankfully the results are coming back faster, and it is pretty easy, at least here in Austin, to get tested and get those results. So that's a great point.
I mean, I am a doctor, and I don't know what it means in 2020 to have a runny nose.
Which says a lot, and people should acknowledge that. We also want to bring it back to the Olympics. I want to show everybody at home some images from a gymnastics meet that was held this past weekend. So we're showing images right now to everybody at home of visitors getting sprayed by a sterilization mister, which looks a little bit like science fiction at this point, and yet still people are sitting closely in the stands while wearing masks, shoulder to shoulder there. Dr. Thomas, in your opinion, how are these measures likely to help the Olympics hold the Summer Games next year?
So again, I believe that the public health interventions that I mentioned and that you just discussed, I believe that they work. So why do I think that they work, and why am I hopeful that the Olympics may actually be able to occur? So we have a couple of examples. So we know, and it's not just in the state of New York and nationally, but internationally, we know that K through 12 schools, when they have gone back to in-person learning, we know that those situations have not been a source for widespread transmission. So why is that? It's because the schools have command and control over public health interventions within their walls. So they reduce the density of students and staff that are in the building. They do screen temperature checks and symptom screening before people come in. All the kids are wearing masks. There's physical distancing in the school. They're limiting the need for gatherings, and they're requiring people to go home if they feel ill and to be tested before they can come back. And as a result of that, they have not had widespread transmission within schools. It's the same sort of thing that we see in the hospitals. So we are seeing a lot of hospital employees around the country who have needed to be quarantined, or hospital employees who have been infected. But the general belief is they're not being infected in the hospital because they're being infected in the community because they're applying these public health interventions within the hospital. So what that says to me is it is possible, if you can control your environment, to drastically reduce the risk of transmission. Now, so do I think screening prior to allowing a spectator into an arena is a good idea? I do. Mandatory mask wearing absolutely has to happen. I would still probably want people to have physical distance between one another and not sitting side by side, because no intervention is 100%. But I think if these types of things are done, you can drastically reduce the risk.
All right.
Definitely good to hear. Dr. Thomas, one more question before we let you go. Because we have a new president-elect here in the country, Joe Biden, the projected winner of the presidency, what do you make of him moving into this role, announcing a task force to look into the coronavirus pandemic at this point?
Yeah, so I mean, as you know, I was in the federal government for a long time, right? I was in the United States Army, and with Ebola and Zika and MERS-CoV, I was fortunate enough to participate in whole of U.S. government responses to those epidemics. And I can tell you, the federal government has a large number of people with incredible expertise, with a great deal of experience. Dr. Fauci, Dr. Birx, Dr. Redfield, people in the Department of Defense, people in BARDA, people at the FDA. These people have been there and they've done that. They know the answer for how we can, as a nation, really bend this curve and get back to the type of life that we want to live, and a higher quality of life. So what I think is important is those people need to be able to do their jobs. And so I think that maybe with a change in senior leadership, that maybe their freedom of movement will change a little bit. I also think, the task force that the president-elect has selected. I mean, we know a lot of those people. I know a lot of those people. These are these are civil servants in many cases that have devoted their lives to protecting people from infectious diseases. And it was really comforting to me to see that list. And again, hope, optimism, we can do this. And I think we're in a good spot with some of these changes.
Yeah, I love leaving people with that message. And congratulations again, Dr. Thomas, and thank you for your time every single month. Hopefully we'll see you again next month.
Absolutely. Thank you.
All right,
Thanks.
Dr. Thomas, thanks again. We'll let you go now.
Yeah, so last month, earlier we talked about gymnastics. They hosted a gymnastics meet there in Tokyo, and they also welcomed some visitors to check out the city's new Aquatic Center. The facility will host Olympic swimming, diving, and artistic swimming and Paralympic swimming competitions, and here's a look at that.
Yeah, the Tokyo Aquatic Center has 10 lanes for the main pool and will have a seating capacity of at least 15,000 when the games begin. Now, we don't know for sure if that will be full to capacity once the games are held and all those kind of COVID measures are announced.
Yeah, it's good to see. It's good to see these facilities and know that Olympians could be competing in there in about a little over 8 months. And speaking of the pool and the swimming/diving competition, we've learned over the last few months that we have got a diver in our midst, in our Nexstar family. Nexstar, of course, owning many stations across the country, including ours. And we've got a star who's a sports anchor in Richmond, Virginia.
Yeah, we're talking about Natalie Calabat. She, again, was a Division I diver and actually went to the Olympic trials at one point. And last week I had a chance to talk to her about that past in the pool. So take a listen to that conversation. First, I want to talk about your history. Before you became a sports anchor, you were a competitive diver, trained at it for a long time. Tell us about that experience and that part of your life.
Yeah, well, it's pretty crazy. I was an aqua nut to begin with. I actually started as a swimmer. Before I could even walk, my mom kind of threw me in the pool, sink or swim, you're going to be a swimmer. And I actually transitioned to diving around 11 years old, and I'm originally from Princeton, New Jersey, and got a diving scholarship to dive all the way on the West Coast at USC in Los Angeles, and got to travel across the country, and I competed at the US Olympic trials in 2012. So it's been a pretty crazy ride, a lot of traveling, and it has prepared me well for broadcasting. I see a lot of similarities from diving to what I'm doing now as a sportscaster.
You did mention that you competed in the U.S. Olympic trials back in 2012 for synchronized diving. That's a huge accomplishment in itself, but why I want to bring that up is that you know exactly what these athletes are going through trying to prepare for what was supposed to be the 2020 Olympic Games. How do you think those athletes are faring now since training may have slowed for some and competitions are not happening at all for others?
It has to be, a big change of momentum. These athletes, prepare their bodies, their mind, their diets, literally everything for this past summer, and then things change. So obviously the training is going to be a lot different for these athletes now that they have to adjust their schedule. Which, at this level is huge, and, may the best athletes win. I mean, we're going to see a lot of athletes maybe come out of left field, people that prepared themselves differently than other athletes who prepared themselves for last summer. So I think it'll be a really fun games, and it'll be really interesting to see how all these athletes have executed on demand.
Because you're more dialed into the diving world here in the U.S., how competitive do you think the U.S. Olympic team will be at these next Olympic Games?
I think they'll be competitive. I have definitely been keeping tabs on all of the divers, and they've been working really hard. On land and in the water, diving is a lot about training your muscle memory, through dry land, through ab training, weight training, trampoline, dry board, as well as executing in the water. So I think we're going to have a pretty dominant United States Olympic diving team, and you're going to see some pretty amazing athletes on the diving side.
Hopefully we get to see them compete. Natalie, thank you so much again for joining us. We really appreciate it.
Thank you for having me, Will. It was awesome.
That is awesome. From Olympic hopeful to sports anchor at a WRIC in Richmond, Virginia.
Yeah, I don't know if you saw those videos going back to them. I mean, she was doing some really impressive tricks from the diving board.
Yeah, I know nothing about diving, although being one of our Olympic reporters for Nexstar here in Austin at the University of Texas, big time diving university and community here in Austin, and I got to see some of the Olympic hopefuls as they were training for Tokyo 2020, and it is so impressive. And I did used to, and so did you, Will, used to be a gymnast, and they were actually doing some gymnastic moves on the mats prior to getting in the water, and I was like, okay, I get that. I get those backflips.
We can relate to that.
Yeah, working on their form before they then translate it to the diving board and to the water. And so I was like, hey, we used to be semi in shape, not maybe Olympic hopefuls,
Much
but
more flexible back then too. Yeah.
Yeah, Natalie, thank you. Great conversation with her.
Yeah, it was really cool to meet her, and again, she's a very talented person, and we hope maybe she'll come back and talk about Olympic diving when the Olympics are held next year.
Yeah, absolutely. So, we have been talking for months since this pandemic hit about how these Olympic hopefuls have had to get creative with their training when gyms and pools shut down and they couldn't be around anyone else. So all they had were maybe some of their own homes and apartments and weights at their disposal or backyards, whatever their sport might be. And so it's also, like I said, force them to get creative. Our Olympic team, our reporters have been doing a lot of great stories about what this looks like for each and every athlete. And so one of my Nexstar Olympic teammates going to Tokyo to cover the games, hopefully next July, Marielena Baloris has a story of an Olympic hopeful and her husband who took matters into their own hands. Watch this.
Emily Lapari was coming off her best indoor track season when the news broke. Tokyo 2020 would now be Tokyo 2021.
You were 4 months away from being so locked into this goal that you've had set for years. And then you have to now readjust it for 18 months later, which is sometimes a little bit of a hard mental shift.
She refused to let the change get her off track. She refocused and had her best summer training season. But something was missing: competition.
I just wanted to get out there, wanted to race, wanted to break up the routine a little.
That's where her friends, Elena and Brian Tabb, come in.
I was getting really fit and there were no races on the schedule. So Brian's idea was, well, why don't we put on a race?
That was a conversation they had in July. They decided to host a race in just 2 months on Labor Day. So they got to work, securing a track, lining up medical staff, getting sponsors, creating COVID safety measures, and more.
I didn't realize how much work it would be. So it was easier to take one piece at a time.
Those pieces came together with 50 athletes, mostly elite, competing in different events throughout the afternoon.
It gives you something to train for and to get to that next level in workouts, and having those short-term goals makes training a lot more manageable and a lot more fun.
A rewarding race weekend for everybody involved.
The start of it was for Elena, but the end result ended up benefiting so many more people than I could have imagined. So it's cool. It's fun to think about that way.
On the journey to Tokyo, I'm Marielena Baloris.
I love it. I love it. I love it. Instead of thinking what we can't do, let's get creative and try to make something happen in this
and still
environment.
be safe too.
Yeah, yeah. And it makes you want to go get in shape after seeing those athletes running around the track. You can't see, but I'm almost 8 months pregnant at this point, so someday I'll get back to working out.
Yeah, it'll be perfect.
It'll be great. So switching gears here, I, a few months ago, got to delve into the topic of Olympic advertising. So we come to you every month, we talk about the athletes, we talk about the fans, and what we haven't really dove into is talking about the Olympic advertisers. And just like here in the U.S., the Super Bowl, I mean, the advertisements are such a big part of that. You sit down and watch the game, and then you look for the commercials as well. And so same thing for the Olympics. Leading up to the Olympics and during the Olympics, the commercials are awesome to watch. And so we wanted to dive into, with these advertisements when the pandemic pandemic hit and the Olympic Games were postponed, what did advertisers do at that point? What part of the conversation were you in? Will, do you remember any of the Olympic ads that have played out over the last few years?
More so, it's like highlighting some of those moments that are just stellar Olympic things that have happened athletically. So I'm thinking particularly about gymnastics. I mean, that is always the sport that I gravitate toward and want to watch. And I remember just them highlighting, Gabby Douglas, Simone Biles, Aly Raisman, all those people and like their amazing tricks and sticking landings and all that. That's what I look forward to.
Yeah, and typically they like tear at the heartstrings.
Oh, yeah. It's very inspiring and hopeful, and that's what we love about the Olympics, to watch. It makes it more fun.
Yeah, and sometimes, they show their parents in the stands, or they talk about they talk about the story of that athlete getting to where they were. And so I started calling up different Olympic advertisers, and there's advertisers or sponsors, and some of the big names that come to mind, like Coca-Cola, Visa. And so Visa actually agreed to do a Zoom interview with me. The Chief Brand and Innovation Officer, Chris Curtin, I got to talk to him just a couple of months ago about what that postponement looked like behind the scenes, how much work they put into these ads, and are you switching gears at this point to then prepare for a completely different plan in 2021, because our world looks so different with COVID and a lot of the conversations going on about police protests, and what are you going to tackle in these advertisements that's really going to relate to people watching them in this new world that we're in when the Olympics happen, in July of next year. And so we had a great conversation, and one of the cool things he talked about, just like an Olympic athlete, it takes 2 years to put one of these ad campaigns together. So it's like an Olympic feat for them to get ready for the games. And they also, if you've never been to Olympic Games, which isn't a lot of you, because it's an incredible thing to go to, but when you show up in the Olympic Village, there are ads everywhere, and Visa's name is on everything, and you can only use a Visa credit card because they have, really own the games. And so, he talked to me though about commercials that play now on social media and on TV, and they were working on this entire ad campaign prior to COVID that centered around the thought of, this is easy, and then this is not easy. So I'm not doing a good job of explaining this, but basically their big thing in Tokyo is trying to push toward contactless transactions. So not even having to get your card out of your wallet or purse to pay for something, using your cell phone to do that. And so they were going to try to forward Japan's mission in this at the games in Tokyo. And so the original plan prior to COVID was to show somebody like Simone Biles doing this incredible gymnastics move, and clearly that's not easy, but then showing her then using like a contactless credit card and saying, but this is easy and you can do this. You may not be able to do that gymnastics move, or you certainly can't do that gymnastics move, but you can do something like this. And so then when COVID hit, they had to pivot. They stayed with that same overall message, but they asked the athletes who are sponsored by Visa, hey, can you help us make a new commercial with this same overall idea and thought, but we're going to totally switch it around. And so they allowed me to share that commercial with you. We've got, it's just a little bit less than a minute. So watch how they totally pivoted to do something different, but keep that same general message.
Hi, I'm Sky Brown.
Hi, I'm Sean McCall, and this is not easy.
This isn't easy.
But this is easy.
So, Will, that may have been your first time seeing that entire commercial. What are your thoughts?
Yeah, what I love is that not only they're highlighting their athleticism first all, but then they're showing they're an example for hand washing and making it look fun in a way. And I think that kind of rubs off on people when they watch it, that even those athletes that they see up on screen doing incredible things, they practice safety too.
Yeah, what's cool is Chris was telling me that they asked these athletes to just shoot all this footage on their cell phone. I mean, we've all gotten used to that now with the FaceTime and the Skype and the Zoom interviews that we're doing for everything to stay safe. But, you know, I'm sure they had this beautifully produced commercial prior to COVID that, you know, got this incredible message across, and then they had to scrap that and say, you know what, we're just going to ask the athletes we sponsor to grab their cell phones, shoot video of them, you know, doing unique and cool things at their house, and then show how they're staying safe during the pandemic. And so they said that this thing, it went out on social media. I don't know if it aired on TV as well, but it went viral and people loved it. And so again, you know, all those athletes, they sponsor athletes around the world. And another cool thing is that, you know, they have contracts with these athletes to be sponsored by Visa. And Visa was one of the first companies to actually renew those contracts and reach out to the athletes when 2020 was postponed and say, hey, you know, obviously we're so incredibly sorry that you're having to go through this right now, but we would like to renew your contract for another year. And many of them signed on and said, yes, thank you so much. And so they were one of the first companies to do that and keep their Visa athlete relationship. And so it's really neat. And plus, I mean, a lot of times here in the U.S., we focus on a lot of the U.S. athletes, and it's neat to see a lot of the international athletes in those commercials as well. And
that
see
was
them.
something I wanted to point out. It was so cool not only to see different sports represented, and some that we've not even seen just yet, like skateboarding. I mean, that's a pretty amazing thing. But the Chinese gymnast leaping over his coffee table to do like a handstand on his couch.
Yeah.
Pretty amazing.
And there's something very personal. I mean, you're in their personal space. We're in their bathroom with them at their sink. We're seeing their living room. And I think that's one of the coolest things that's, you know, come out of this pandemic, whether it's us, you know, doing some kind of shot in our living room or kitchen. You're in their personal space, and it feels like you're just, you know, friends with them, watching them live their daily lives.
And it also gives you an incentive to like keep things neat and tidy behind you.
Right. Let me clean this up real quick.
Yeah, right.
We all do that. But anyways, I just want to thank Visa and Chris Curtin. I know they're working hard right now. Not to mention, you know, we've talked about how the postponement of the summer games is now eating into, you know, the winter games in 2022, the World Cup. Visa is working on ads for all of these huge events, and so they are working overtime. But he said, you know what, it's giving us a great distraction for our team to stay busy while many of us are working from home and really do something we love. So we cannot wait to see the advertisements that come out. Now we'll have even extra time to work on them.
That is for sure. I wanted to highlight that and say they have all the time in the world now to be able to create something really cool. So it'll be fun to see what they come up with.
Yeah, for sure. So I think that's all we've got for you guys this morning. Yeah, we're going to see you again first Tuesday. Are we back on track next month?
I believe so. That's the intent. So the first Tuesday in December, you will see us right back here sharing the latest headlines about Japan 2020 and the Olympics, and we hope there's better news to share about the pandemic too.
Yeah, and how they are preparing to, I mean, we think, and everything we've heard is that they're gung-ho and preparing for these Olympic Games to happen. I was just making sure that I've got the right date in mind. July 23rd is when the Summer Games in 2021 are set to kick off, and we'll be here telling you all the news that you can use to prepare for that and get excited.
All right, everybody. Thanks so much for joining our stream again. I'm Will DuPree.
I'm Erin Cargile coming to you from Austin. Have a great rest of your week.